Welcome to another AMA Steps Forward Innovation Academy webinar presented by the BHI Collaborative. The Collaborative is a collective product of the nation's leading physician organizations dedicated to equipping physicians and their practices with the necessary knowledge to sustain a whole person, integrated, and equitable approach to physical, mental, and behavioral health care. We are committed to ensuring a professionally satisfying, sustainable physician practice experience and act as a trusted partner to help physicians and their care teams overcome the obstacles that stand in the way of meeting their patients' mental and behavioral health needs. This webinar is titled Supportive Services in an Oncology Practice, Meeting the Patients Where They Are. Before we get started, please note that this webinar is for informational purposes only and is believed to be current and accurate at the time of posting. Please consult a professional advisor for specific medical, legal, financial, or other advice. References and links to third parties do not constitute endorsement or warranty by the American Medical Association. If you have any questions or concerns, please send your inquiries to practice.sustainability@ama-assn.org. In this webinar, Dr. Chiara Battelli, president at the New England Cancer Specialists, will discuss how their physician-owned medical oncology and hematology practice has improved the care and support of their cancer patients by addressing both their physical and mental health needs. Term survivorship or supportive care, learn how this team of oncologists and hematologists revamped their program to support patients as they navigate new experiences and challenges resulting from their cancer diagnosis using behavioral health integration. But before we jump into today's discussion, I would like to quickly run through the learning objectives. Today, the discussion will help you understand the importance of making mental health a priority in specialty care. You'll have an appreciation for the importance of having an integrated mental health program to be able to address the unique needs of each patient when and where they are in their journey. And today's discussion will also help you identify barriers to address mental health and create behavioral health programs in all aspects of patient care. And with that, I will turn the discussion over to Dr. Battelli.
Thank you. And I would like to thank the American Medical Association to give me the opportunity to speak to you today and to advocate for an important program that our practice has really taken at heart. Next slide. As I was introduced, my name is Chiara Battelli and I am a medical oncologist. I specialize in the care of patients with the diagnosis of breast cancer, and I also serve as the president of New England Cancer Specialists. New England Cancer Specialists is a physician-owned and physician-led private practice. It was founded over 50 years ago and is serving patients with cancer and blood disorders in the state of Maine and New Hampshire. We have 17 medical oncologists and hematologists, one palliative care physician, one internal medicine physician that lead the survivorship care program, 23 advanced care providers, 3 genetic counselors, 1 nutritionist, 3 licensed clinical social workers for a total of 308 employees. And currently, we have the honor to serve over 14,000 active patients in our 4 locations of Thompson, Scarborough, and Kennebank in the state of Maine and Portsmouth in the state of New Hampshire. Next slide. I think the rest of the conversation today is gonna stem from our mission, which is to achieve the best possible outcome for each patient, starting with the expert, specialized, cutting-edge, and compassionate care, all of it supported by integrated services. As a company, we have recognized that we acknowledge that every patient has unique needs and require a unique set of elements to support them. We believe that healing after a cancer diagnosis is only possible by addressing the needs of the entire person. And we have decided to invest in providing integrated support services. Next slide. As I'm referring to integrated support services, I wanted to give you an idea of what I am referring to with this word. We'll focus our attention mostly on the first one, mental health support today. But this is part of a larger program that includes financial support, patient peer support, nutrition, survivorship, health coaching, physical activity, genetics, and palliative care. Next slide, please. So how did our journey started in this field? In 2021, New England Cancer Specialists decided to start an in-house mental health program, hiring specially trained social workers with the role to help patients and their families and caregivers dealing with the highly emotional experience of facing cancer. As practicing physicians, I think that the reason why we came to this decision is explained with the next three cases that I will show. And again, are all three breast cancer cases because of my kind of practice. Next slide, please. So let's meet Lisa. Lisa is a patient of mine I met a few years ago. She was in her early 50s at the time when she was diagnosed with breast cancer, and she was about to run her third marathon. Her physical activity and her gym community was really her group and her family. She was teaching at the boot camp, and she was highly social in that group. She underwent surgery, chemotherapy, endocrine therapy. She did overall well during this journey. And I was extremely excited 3 years later when she came back to follow up, and she said that she had just run a 10-mile race. I was super excited. And my excitement lasted very short because she curbed my enthusiasm by simply stating that cancer had completely ruined her life. Next slide. That's another case. This was a young woman, 38-year-old, that had a 2-year-old daughter when she was initially diagnosed with breast cancer and had to start chemotherapy. As part of the chemotherapy regimen, she received steroids, and she was very sensitive to steroids, and for the following 3 days, she couldn't really sleep. When she came to follow up, and obviously I was reviewing the side effects of the chemotherapy, she really didn't have much in terms of side effects, but she was in tears. She was desperate at the time, and she started to say that she was absolutely convinced she was going to harm herself and her daughter. We had to admit her for a longer period of time to a psychiatry unit and delaying further care because of that. Next slide. This is my last case that I would like to present to you. A 45-year-old woman, single mom of a 15-year-old girl. She was diagnosed with breast cancer, a relatively aggressive form, and the biggest struggle that this woman facing her mortality had was actually dealing and making decision considering the anxiety of her daughters and her daughter's inability to cope with the stress of her mom diagnosis of breast cancer. While the examples that I gave may seem to be anecdotal, the importance and need to address the emotional distress of cancer patients is well known in the literature. There are studies that have shown that 20 to 62% of cancer patients have a significant level of distress facing their cancer diagnosis and treatment, and that this distress is impacting the adherence to their cancer treatment, their decision-making process, has an important impact in the healthcare utilization, including the number of visits to the physician office, visit to the emergency room, hospitalization, and beyond impacting the quality of life, it also impacts their outcome. The national guidelines for cancer care recognize the importance of acknowledging and screening for distress. But beyond recognizing and acknowledging the distress, it's also well known that having tools to address the distress impact the well-being of the patients, and that these tools have to be put in place early in their journey. Next slide. So while this is very well recognized, there are still a significant number of barriers that impact our ability to offer a whole support to the patient. First of all, it's a matter of knowing, recognition of the patient's psychological needs. There are very few community resources, and the majority of them are paid out of pocket with low or inadequate reimbursement. It is cumbersome, the referral process, and there are insufficient local services. There is lack of flexibility and availability of mental health provider in the community. And still there is a stigma for the patients and their family to seek help and support in their journey from an emotional standpoint. And lastly, adding another visit, another appointment is a burden for the patient and for their family in terms of time, transportation, and even being able to identify the coverage and the available providers. Next slide. So how did we start our program in 2021? Well, first step, ask. This is part of our work of every day, and it's simple to do. We ask every patient PHQ-2 every 90 days. And every time we start a new treatment or we change the treatment, which usually means a change in the course of their disease, we use the NCCN distress thermometer. And through that, if we identify the need of the patient, we move to the next step. Next slide, please. So once we identify the problem, we offer help, and we tried to make it as easy as possible. That's how the program was born in 2021, when we hired our first licensed clinical social worker. As they say, you start by crawling and then you walk and run, and that's how we started. And we are not running yet, but we started with a counselor, and after few months, in May 2022, we added a second time counselor, and then in 2023 we added a third part-time, and by the time we are gonna be at the end of 2024, we'll have 3 full-time counselors. In 2022, when the second counselor was added, we were also able to offer counseling to the caregiver, not only to the patient. Since the beginning of our program, and this data are as of February 2024, our licensed clinical social workers have seen 747 unique patients for a total of 3,413 visits to patients and 72 caregivers. And the most common reason for referral have been adjustment disorder, depression, anxiety, substance abuse, including smoking, and nicotine dependence, anorexia, insomnia, and phobias. In 2022, the counselor launched a Cancer Connection program, a peer-to-peer program in which they train mentees and they offer connection between patients and other patients who have experienced a similar cancer diagnosis. Next slide, please. In 2023, they started also a monthly meeting for patients that are 90 and older, because it was recognized that they are more prone to have social isolation. And in 2024, they started a support group for patients living with metastatic disease, and not only survivors or patients during the active phase of their early treatment. And coming up soon, there is a new program that is a smoking treatment program that they will lead with the support of the American Heart Association. Next slide, please. So what was the advantages that we have seen in creating an integrated behavioral health service? They are truly and really an integral part of our patient medical team. They can adapt to our patient's need. So they are flexible with last-minute cancellation, last-minute need to see the patient at the chair side. They can intervene in moments of crisis, help patient with the advanced directives. And our counselors, they all take insurance. And the purpose is to minimize the financial burden and to make this program as accessible as possible. They hold and facilitate monthly interdisciplinary meeting with the palliative care department. They support the medical team, and they lead programs like Reflection and Guiding Celebration of Life to help us as medical provider to cope with the heaviness of facing many losses in our years and in our profession. And lastly, they try to meet the patients really where they are, and sometimes even walking around the building and in the trail around the practice, so that the patient that don't have the time can combine their walking activity with their counseling. Next slide. In the future, what we are looking at expanding the program. I already alluded to the fact that by the end of this year, we are going to have 3 full-time instead than 2.5 full-time, 2.5 social worker. But we would also like to move forward in incorporating a psychiatrist or a psychiatry nurse practitioner to be able to prescribe drugs and to address that need that is unmet in a lot of communities, including ours. We are working actively in developing a geriatric oncology program. And lastly, we are looking into offering formal neurocognitive testing for our patients to help them cope with the significant impact on their cognition that can come with the treatment. Next slide, please. I wouldn't be complete or fair if I did not mention our step 3. And I think this is an extraordinary important slide that it's different for each of us in different communities, but the generosity of the community is everywhere. In our, we are thankful for 2 organizations, the Dempsey Center, a nonprofit organization with the mission of making life better for people impacted by cancer, offering personalized care through counseling, support groups, nutrition, integrative therapies, movement and fitness, and the Center for Grieving Children, a nonprofit organization that provides safe space, loving peer support, outreach and education to grieving children, teens, young adult, families and community. All of this is free of charge for the patients, and we collaborate closely with these 2 groups to offer additional support to meet the needs of our patients. Next slide. I think that sharing my experience and the experience of our group can be of inspiration, hopefully, to others to create similar services. We have been one of the pilot center of the ASCO accreditation. And in that accreditation, there were 12 different oncology practices, private, academic, hospital-based, and one section of the standard that were proposed was indeed on mental health and behavioral health need. And we know all that can be done in different practices and in different settings. So how we can make this really happening and be sustainable, because I'm sure that you thought about how can we sustain these programs. Well, the first 3 bullets here summarize a little bit our experience. Ask the patient, meet the patient where they are, and create your own program without forgetting to partner with the local resources. But to make it sustainable, I think we really have to work on the next part of this slide, meaning advocating. the American Society of Clinical Oncology, the American Medical Association. We need to continue to advocate for a broader mental health coverage. And I'm really appreciative to see that this need of the patient is not only touching primary care physician, the oncology specialty, but is really expanding to other specialties, and the attention is expanded to our specialists. We can all work together between different disciplines and different society to make this a priority for our patients, create research around it, and again, create a community where the legislation, the physician, the advocate, we can all work together to address the whole care of our patients. Thank you again for giving me the opportunity to talk to you about our experience.
Great. Thank you again, Dr. Batelli, for sharing your expertise and experience with our viewers today. Viewers, if you have any questions regarding today's webinar, please reach out to us at practice.sustainability@ama-assn.org, and we will field your questions. For a full listing of the BHI Collaborative's previous recordings, please follow the QR code at the top right of your screen to our YouTube playlist. Please also check out the Collaborative's BHI Compendium for a helpful framework on how you can make BHI effective in your practice, along with other actionable resources and practice case studies. You can also access the AMA's strategic practice guides on the AMA website for implementing specific topics associated with effective behavioral health integration, including pharmacological treatment, care for substance use disorder, suicide prevention, workflow design, billing and coding, and integrated behavioral health care for older adults. Finally, you can register for upcoming BHI Collaborative webinars from the AMA Steps Forward Innovation Academy by scanning the QR code on this slide. Thank you so much for joining us today.